Good day to you viewers out there. I'm having in the studio some executive members of Pharmaceutical Society of Nigeria. Leading them to the studio of Pop TV is the chairman of Ekiti Branch, and that is pharmacist Bolanle Oreyemi Oshoba.
Thank you. With me here today is pharmacist Oyeniran Michael Olufemi. He is the chairman planning committee for this Pharmacy AGM Scientific Conference that we're having. He is also the General Manager, Ekiti State Drug and Health Management Supplies Management Agency at Ekiti here. Also seated to my left is the Director, Pharmaceutical Services, Ministry of Health, Pharmacist Olawale Stephen Olajide, who is a member of the planning committee of our program.
We are going to be looking at some of the activities to celebrate, the Earth Week in Ekiti State, groundbreaking annual scientific conference and annual general meeting. Why now?
Thank you very much. Like the name implies, annual general meeting. However, it's not a general feature for us as pharmacists. We've been gathering, but this year we decided to put structure into our activities, and that is why we are formally having an annual general meeting, and we're also deciding that it's high time that we as pharmacists have a structure, a place we can call our own in Ekiti, and that is why we are doing our groundbreaking ceremony. It can happen any time of the year, but we have chosen this time because this is around the first year after this tenure started. Thank you.
Okay, if I may come to you, Mr. Chairman, Planning Committee. I'm so sure that by the time you are planning for this, event, there are certain things that are running through your mind. Can you please tell us, as at that time, what you intend to achieve, with this program?
This year's program was well structured by the executive. They put me and my team together to work out the modality for the implementation of the program. The groundbreaking we're talking about is that we have a property where we have to work on, and this program has given opportunity to start the project, and that's why we say groundbreaking, laying the foundation. We can put in another, that's laying of the foundation of the property. Now go to the program. When we sat down, we programmed in that definitely we must have that property commenced during this program, and that we have invited a lot of people to assist us, and we have even assisted ourselves by contributing individually as a pharmacist and as a technical group and as a government representative to put resources together to make sure that this program comes to reality. We expect the scientific to come. We have invited an erudite professor to come and talk to us.
Pharmacy profession in Nigeria expanding the frontiers. What informed this team?
We have chosen a topic like this for this time because you'll agree with me that the world is evolving. We have moved on from the way things used to be, and we have told ourselves that as pharmacists we have to move, we have to be dynamic so that we will remain relevant in the scheme of things. We have told ourselves that we will strategically situate ourselves so that all of the things that would help for the better life of people, health and well-being of Ekiti citizens, we will be a part of it. Pharmacists have to live up to the expectations of the present day demands. We are no longer attending to our patients over windows anymore. We are no longer rigid. We are making our services as flexible, as technologically appliant, and making it modern enough to reach out to our patients and clients and to let them know that their drugs are not just, they are not food, they are not granules, they are not snacks. That for you to take your medicines, you need your pharmacist. We are going to be changing the way things are seen around the society so that people will appreciate that drugs need to be handled by professionals.
The world is evolving, and then Nigeria as a country cannot be found behind in this scheme of things. So we actually want to make the pharmacy profession in Nigeria what it ought to be, so that our people will have the best of the practice as it's obtained worldwide.
Expanding the true frontiers, that's the main language in that topic.
Yes.
You agree with me that pharmacy practice, to those that have gone out of this country, the way we practice pharmacy, let's take Ekiti as a case study.
Okay.
It's not like that. It's not the best international practice. How? If you want to access drug, you're supposed to go to a pharmacy with your prescription. But it's not like that in Ekiti. Anybody can just walk in and say, I want to buy this, I want to buy, and that's what can lead to drug abuse. So we are now taking this topic that, okay, let's enlighten our audience. What is expanded frontiers? Pharmacy is supposed to be practiced the way it is done outside the country. Go to pharmacy, go there with your prescription. With your prescription, the pharmacist can advise your doctor on the drug you are taking. It's not to criticize, but to advise. At times you advise your doctor and he will say, okay, change this position to so drug, so dose. And that is the essence of having a pharmacist in place. And that's what we are trying to do. We want to change the nomenclature of how pharmacy is being practiced in Ekiti State. And that is the message of this team.
Okay, for this health week, itemize some of the programs that will be coming up. Then aside from that, who and who are we really expecting?
First of all, we are expecting our guest lecturer, Professor W. Aaron. He's a erudite scholar. By the time he handled this topic, I know that everybody will be happy and everybody will go out of that venue a changed man. We are expecting Professor Aaron as a guest lecturer. We are expecting Dr. Ayebe, that is the managing director of Feasting Pharmaceutical Healthcare. We are expecting our registrar, PCN Ekota from Abuja, and we are expecting the Honorable Commissioner for the #1 health man in Ekiti State. All of them will be in attendance to grace the occasion, and other eminent personality that will be coming.
Professor Cyril Usifo, who is the #1 pharmacist in Nigeria, will be joining us all the way from Lagos, and it is an honor to be hosting him for the very first time in Ekiti.
The earthwork, and what informed this? What message do you really want to pass out?
The earthwork serves dual purpose. #1, we want to go out. You can see my colleagues in our customized t-shirt telling the whole world that pharmacists in Ekiti, they are out for a program. The earthwork #1 is to tell people that if you walk around, you improve on your health. Not just if you want to go for about 2 or 3 kilometers, you have to go with Okada, you have to no. Health will increase your longevity. It increases your lifespan. The heart will be challenged so that the heart can pump more blood. By the time you walk for about 2 or 3 kilometers, you will sweat. All those excess toxic compounds in your body will be out. So that is, apart from that, we want to showcase, we want to write to the people in the state that, okay, that is pharmacists. Many people, when you go to hospital, the men working there, they are doctors. The women there, they are nurses. No. There are pharmacists in the hospital, and they occupy a very big place. For you to access drug, you must go to pharmacy department. Drug counseling. We know the kind of drug that you're supposed to take. So it's not just to come to hospital and say you have seen doctor and you have seen nurse. No, pharmacist is there. An average, more than 80% of patients that come to hospital will go to pharmacy to access drugs. So pharmacy, we have to think on how to improve on the health of the society. So the health work, #1, to popularize our activities, then to enlighten people that it's good for you to take a walk at least 1 or 2 daily.
We would create some awareness.
The people that are called pharmacists.
Let people know that pharmacists exist. We are your drug experts. You can consult us for your drug needs. I'll try to make them know that there's a difference between a pharmacy and a drugstore where you just enter. Give me paracetamol, give me Uri for me, do a shapo and all of that, which is not beneficial to the health of our indigents. We want them to know that there are some people that are trained to help you with these minor ailments. You can walk up into the community pharmacy to access care for simple ailments.
Viewers, this is how far we can go today on this program. The PSN is having its first ever annual scientific conference, groundbreaking ceremony, and the annual general meeting between July 7 and 8, 2023.
People of the Fountain.